Welcome to this important discussion about the hidden dangers of over-the-counter (OTC) medications for seniors. Over-the-counter drugs are often seen as a quick and easy solution for common ailments like headaches, joint pain, cold symptoms, and digestive issues. However, there is a darker side to OTC medications that is rarely discussed but can have devastating effects on seniors. Today, we'll explore why these drugs can pose serious risks for older adults, how they interact with other medications, and how you can protect yourself or your loved ones from their harmful effects. First, let's talk about the aging process itself. As we grow older, our bodies undergo significant changes that affect how we process medications. Seniors typically have slower metabolisms, which means that drugs stay in the system longer and can have a greater effect. The liver and kidneys, which are responsible for processing and eliminating medications, also become less efficient with age. This makes it harder for the body to clear drugs from the system, leading to an increased risk of adverse effects. In addition to that, many seniors are taking multiple medications at once. This is known as polypharmacy, and it's a common situation in the elderly population. Polypharmacy can be dangerous because it increases the chances of drug interactions. Over-the-counter medications, when combined with prescription drugs, can create a perfect storm of negative health outcomes that are often overlooked. So, what exactly are the risks associated with OTC medications? Let's break it down and take a closer look at the most common drugs seniors are using and the hidden dangers they may carry. Pain relievers. One of the most commonly used over-the-counter medications by seniors is pain relievers, specifically non-steroidal anti-inflammatory drugs. NSAIDs, like ibuprofen and naproxen. While these drugs are effective at reducing pain and inflammation, they come with a host of risks, particularly for older adults. First, NSAIDs can have a negative impact on kidney function. As seniors age, their kidneys naturally lose some of their filtering capacity, and NSAIDs put additional strain on these organs. Over time, prolonged use of these medications can lead to kidney damage or even kidney failure. Kidney problems can be insidious, and by the time symptoms appear, the damage may already be severe. Another problem with pain relievers like ibuprofen is that they can cause gastrointestinal issues. NSAIDs can irritate the stomach lining, leading to ulcers, bleeding, or other digestive issues. For seniors, who may already have sensitive stomachs or a history of ulcers, this can be particularly dangerous. On top of that, NSAIDs can raise blood pressure, which is another concern for seniors who may already be taking medications for hypertension. High blood pressure can lead to heart attacks, strokes, and other cardiovascular issues, and taking NSAIDs can exacerbate this risk. Acetaminophen. Acetaminophen, often sold under brand names like Tylenol, is another common pain reliever that seems to be a safer alternative to NSAIDs. However, this medication has its own set of risks, particularly for the liver. Acetaminophen is metabolized by the liver, and when taken in excessive amounts, it can cause severe liver damage. The issue with acetaminophen is that it's often included in many different over-the-counter products. You may take one pill for pain and another for a cold, and before you know it, you're consuming multiple doses of acetaminophen without realizing it. This can easily lead to an overdose, which can be deadly. Seniors, especially those with pre-existing liver conditions, need to be particularly cautious with acetaminophen use. Cold and allergy medications. Cold and allergy medications, especially those that contain antihistamines and decongestants, are another area of concern. While they may provide relief for common symptoms like a runny nose or congestion, they can have dangerous side effects, particularly for older adults. Antihistamines like diphenhydramine, Benadryl, can cause drowsiness and confusion. For seniors, this increases the risk of falls, which is one of the leading causes of injury and death in older adults. The sedative effects of antihistamines can impair cognitive function, making it harder for seniors to think clearly or react quickly. This can be particularly dangerous for those with dementia or Alzheimer's disease, as these medications can worsen symptoms. Decongestants, which are often found in cold medications, can increase blood pressure and heart rate. For seniors with existing heart conditions or those taking blood pressure medications, decongestants can trigger a range of cardiovascular problems, from elevated blood pressure to heart attacks or strokes. Antacids and digestive medications. Many seniors suffer from acid reflux or heartburn, and as a result, antacids and other digestive medications are frequently used. While these medications are effective at alleviating heartburn, they can cause problems when used long-term. Prolonged use of antacids can interfere with the body's ability to absorb important nutrients like calcium and magnesium. This can lead to bone weakness, osteoporosis, and an increased risk of fractures. Some seniors may also turn to proton pump inhibitors, PPIs, which block acid production in the stomach. While these medications can help with acid reflux, they can have serious side effects if used for extended periods. PPIs can interfere with the absorption of vital nutrients like vitamin B12, calcium, and iron, leading to deficiencies and other health problems. Additionally, antacids can alter the balance of stomach acid, which can increase the risk of gastrointestinal infections, such as Clostridium difficile, C. diff. This is especially dangerous for seniors with weakened immune systems or those who have recently been hospitalized. The hidden risk of drug interactions. Perhaps one of the most dangerous aspects of over-the-counter medications for seniors is how they interact with prescription drugs. Seniors often take multiple medications for various health conditions, and many of these medications can interact with OTC drugs in harmful ways. For example, taking a decongestant with a blood pressure medication can cause an unsafe increase in blood pressure. Mixing OTC pain relievers with blood thinners like warfarin can increase the risk of bleeding. Antihistamines can interact with medications for depression, anxiety, and insomnia, leading to increased sedation and impaired cognitive function. This is where the real danger lies. Many seniors may not even realize that they are putting themselves at risk by combining OTC medications with their prescription drugs. Unfortunately, this kind of dangerous combination often goes unnoticed because seniors don't always inform their doctors or pharmacists about what over-the-counter drugs they're taking. What can you do? The first step in avoiding these risks is awareness. Seniors and their caregivers need to be fully aware of the medications they're taking, both prescription and over-the-counter. If you or your loved one is unsure about whether an OTC medication is safe to use with other drugs, always check with a healthcare provider or pharmacist. The next step is regular medication reviews. Seniors should review all of their medications, including OTC drugs, with their doctor at least once a year. This ensures that any potential interactions or risks are identified early on. It's also a good idea to maintain a written list of all medications being taken, so nothing is forgotten during medical appointments. Lastly, never self-medicate. Over-the-counter medications are not always as harmless as they seem, and using them without professional guidance can have serious consequences. Seniors should always follow the recommended dosage and never take more than what's stated on the label unless advised by a healthcare provider. Conclusion: while over-the-counter medications can be a convenient and cost-effective way to manage common health problems, they carry significant risks for seniors. From pain relievers and cold medications to antacids and allergy drugs, the dangers are often hidden and can lead to serious health complications. By staying informed, maintaining open communication with healthcare providers, and regularly reviewing medication regimens, seniors can protect themselves from the harmful effects of OTC drugs. Remember, just because a medication is available without a prescription doesn't mean it's completely safe, especially for older adults. Thank you for watching, and please share this information with your loved ones. Let's ensure that everyone has the knowledge they need to make informed, safe choices when it comes to their health.